Okay, now let's put the spotlight on the state of Kerala. And that's because the state has now announced a few more COVID curve relaxations. They're actually opening up a little bit more, which is why they're grabbing all the attention right now, because this is coming in the middle of the fact that the cases have been high. Everybody's been discussing what's happening in Kerala. Why is there a spike? Why is the positivity rate so high? Is the Kerala model crumbling? And there's quite a bit of debate around that. But not bothered with all of this, the government has gone ahead and decided that the shops can now open on all days except Sundays. They can function from 7 a.m. to 9 p.m. That even the weekend lockdown that is there will only be for Sundays and not both days, Saturdays and Sundays. They've also given more details of gatherings that can take place. For example, 20 people allowed at weddings and funerals. They've also said no lockdown on August 15th and 23rd on account of Onam festival. But they're also bringing in a micro-containment strategy, something that we have seen in the past in many states, where they would simply make containment zones, smaller ones, individual buildings, bunch of buildings, an area. And the Kerala government says they're going to bring in lockdown in areas with high cases and make these containment zones. And rather than looking at just the positivity rate on an overall basis, they're going to look at testing numbers where there are 10 cases per 1,000 people, and then accordingly they can decide the restrictions for that area. This has obviously triggered the debate again, because just a couple of days ago, Centre's team visited Kerala and they turned around and said containment zones are not made as per the Centre's guidelines. The central team that visited Kerala when the cases went up and did its own investigation turned around and said there is no strict perimeter control, no active surveillance, contact tracing per positive case is very low in Kerala, only household contacts are being targeted, and no more than that in terms of contact tracing is taking place. Remember, Kerala was actually the pioneer in levels of contact tracing the first time around when the pandemic had just hit us, and it had started from Kerala. The central team also said less than 2 contacts traced in Thiruvananthapuram. There is no proper surrounding of buffer zones, high intra-house transmission leading to clusters, and resistance to isolation leading to high positivity rate. They also pointed out a decline in testing, specifically RT-PCR testing, which is very low. They also spoke about low vaccination coverage for eligible population. I don't know if that's Kerala's fault or the fault of the suppliers and policymakers at the center. But this is the two sides of it. So now with this new decision, will this new strategy of the Kerala model for COVID containment work? Is this right way to go ahead? Or as many are saying, how can you unlock when the cases are so high? You are inviting disaster. Is that true? We say good evening to the panelists joining us right now. Dr. Pramila Devi, State Vice President for Kerala BJP. Dr. Sebastian Paul, former Member of Parliament for Lok Sabha of the CPIM. Dr. Anish T.S., Associate Professor for Community Medicine at a government college in Thiruvananthapuram and member of the expert panel of COVID-19 for Government of Kerala. And Dr. Rajiv Dasgupta, Chairperson, Center of Social Medicine and Community Health at JNU, member of the National COVID Task Force. Dr. Anish, I want to start off with you to put these new norms in perspective, where on the face of it, it looks like you are unlocking to a significant extent. But you're also talking about these containment zones. Didn't they already exist? Didn't this micro-containment strategy already exist?
Actually, in Kerala, for the last 1.5 months, we were following a TPR-based containment zone strategy. A containment zone was a panchayat or somewhat an urban area or something like that. But we found that this is not working in containing the numbers, because these areas are very big and it is very difficult to monitor in these areas. So we are just again going for micro-containment. It has got actually an advantage that we can closely monitor in those areas where clusterings are there. That is the advantage, one advantage of that. And second one is a major chunk of that area of that local self-government can be opened up so that the economical activities can be taken place. Because these areas are not affected. If you look at the real data, and you will see that only one part of the panchayat or one part of the municipality is affected. Because of that, we were closing the entire municipality or the entire panchayat out. But that is not working for Kerala. Now, that is why we have actually revised our strategies, and it may be better for the state. It may contain cases, and it will actually keep our economy living. Because you can see in the zero prevalence data that containment strategies was much effective in Kerala. Okay, during the second wave, maybe the most effective containment was in Kerala. That is why we could save a lot of people from infection, and it is very evident from the data. And now we may head to a third wave maybe in the next month. We may get a kind of relaxation maybe in between these two waves. And this time, there is a lot of issues are there, social issues are there. People are committing suicide, especially people, the small shop owners and all. So we have to just hear from them also. They have to leave. And we will be doing a lot of things to contain the outbreak wherever it is affected. And the rest of the places we will relax somewhat so that people can leave. That is the real strategic change that Kerala is actually heading on now.
Okay, Dr. Rajiv Das Gupta, do you think that this strategy will work, or should Kerala have waited with the micro containment strategy, better, higher RT-PCR testing, better contact tracing before they began to unlock, or what they've announced today?
Thank you. I think what's sort of at variance is the strategy that the state government has made a very conscious decision of trying to find a balance between disease incidence and the extent to which economic activities can perhaps safely be resumed, and possibly a more textbook, if I may, and a more conservative approach that the central team has taken. And therefore, the central team has essentially evaluated the situation based on certain gold standards of practice. And this is probably what's at variance. I don't know whether Dr. Anish actually meant that or will agree that's the position. Now, what we have to remember is that about 80% of the strains in Kerala is Delta. And therefore, in a Delta variant-led surge, this is almost, in a sense, expected, with a consistently high test positivity rate above 10% and so on, and particularly about half a dozen districts rather severely affected. Now, the Delta variant, we know, has a very high secondary attack rate, which means it spreads very fast among contacts. And that's what essentially the central team is aiming at, that the isolation is happening at the home level. And therefore, there's a lot of intra-household spread, which is expected in Delta. And this is a strategic shift that the state may consider, but it may not necessarily be easy to be able to protect very large numbers unless the patient is isolated very early on. Now, one advantage with Delta is if you test early enough, by 4 days it is positive, in contrast to about an average of 6 days with the parent strain. So while there are certain advantages, the Delta itself is a very big challenge, and it's quite clear that Kerala is trying its best, but some of the odds are against it. And the central team is essentially pointing out that Kerala actually stepped back a bit into more conventional strategies, contain the situation, and perhaps then relook at the things. That's what I read out of it.
Okay, Dr. Anish, would you want to just respond to this as well and add to it before I go to the political representatives?
No, I think I can come back and tell something.
Okay, so let me bring in then the political representatives, and I'm going to start off with Dr. Sebastian Paul, because Dr. Paul, many would also say that the central team that came down pointed out a whole list of issues which were there in terms of how the surveillance was not up to the mark, the testing was not up to the mark, has prompted you to now change your strategy. But if you are changing your strategy to try and bring the cases down, then why are you unlocking?
No, there is a change in strategy now because the lifting of control and that all these things only partial and conditional. Not everything is being opened up. The shops are permitted to function for 6 days in a week for extended hours, and so the banks are permitted allowed to function. But the other things, the major areas of activity like schools, theaters, public meetings, all those things, everything is under control. It is true that the central team has found some loopholes in the strategy of the government. It is only natural. An expert committee from the center, they may find certain things wanting, and they will suggest things, and the state government will be wholly happy to endorse those things. It is only natural. Whether we call it a model or not, Kerala is fighting the pandemic situation in its own ways and manner. People want more easing of restrictions. They want to come out. They want to start their normal life. There is tremendous pressure on the government for more lifting of restrictions. I don't think it may be the right time or the opportune time to lift all restrictions. But people want it, and it is only natural. So the government is trying, with the help of experts, how to ease the situation, how to normalize the situation, especially during the coming autumn season. All those things will be experimental, and the government's intention is to effectively contain the pandemic and at the same time help the people to have a normal life.
Okay. Dr. Pramila Devi, do you think this is the right thing to do, to be experimental at a time when the cases are still high?
Thank you for asking the question, and I don't consider it right to be experimental. When the state is really haunted and hunted down by the pandemic, and when the state's average is much, much more than the national average, we can never do any such experiments at present. And we know what happened when the state opened up during the Bakrid festival and the TPR went rocketing high. So it would be really fatal. It would be really suicidal for the state to open up. When the shops are allowed to function for 6 days a week, and we've asked, the central team has pointed out the home quarantine doesn't function properly at all. The state is getting things out of control. So that's why the experts committee has criticized the way the state is dealing with the state of affairs. So it would be quite unwise to make such a decision in such a very critical time. And we know even today the TPI is higher than 10. And what's the purpose of closing certain pockets, some micro-containment zones, when the whole, almost the major part, most of the part of the state is opened up? So in a few days, the state government would come to realize that it has made a huge mistake by changing its policy.
But here is the Kerala government, Dr. Pramila Devi, that's saying that we understand that there are risks, but what can we also need to give relief to people. People want this because people have been in lockdown for far too long and they need some relief as well.
Yeah, that's true. People really want to have some relief because we have to take the government has to take care of two things, both life and livelihood. That I agree with them. But at the same time, when the TPR is out of control and when the Delta variant is very much prevalent in the state, now it's not the time for the state to open. So what I mean, the state has to take care of what the people feel about it. And the people who have long been locked down really feel the life getting miserable. And even yesterday, we had a few youth committing suicide. I understand the situation is really wretched in the state. But it's not the proper time to open up. The state has to wait and it has to take the advice given by the central team more seriously. And only when things become under control, the state can take such decisions. Otherwise, it would be really dangerous to do so. And let's see what is happening with the home quarantine. People don't sit under quarantine; they go walking. They go walking out of places, and so much interaction happens. Just as what has happened during the Bakri festival, the festival of Bakri, and such things would be repeating with a newly decided change of policy. And the state government has to listen to the central team, the central panel's advice, and they should be more wary of controlling the situation, keeping things in the hand.
Okay, so you're pointing out, and I think that some amount of responsibility also lies with people. If there are rules, you must at least follow the rules in terms of self-quarantining when it is required. But here is another aspect, Dr. Sebastian Paul, to you before I go back to our experts. One of the rules that you have come out as part of this new strategy says that only persons who've taken at least one dose of COVID-19 2 weeks earlier, at least, or are in possession of an RT-PCR negative certificate, which is valid for about 72 hours, can actually enter as workers or visitors in shops, markets, banks, public and private offices, financial institutions, factories, industrial establishments. Dr. Paul, are we really expecting this to work on ground, this to be implemented? Who's checking when I go to shop into a store, whether I have a one-dose vaccine certificate or an RT-PCR certificate 72 hours old? Is it even practical?
I think the government has to revisit on that aspect. There is widespread criticism in this regard. That is, as you said, it is highly impracticable to see whether people have taken vaccine, single dose vaccine or double dose vaccine. All those things are it may prove to be futile. The relaxations given at this time may prove to be futile if we insist on such conditions. But everything, as I said earlier, we are experimenting with so many things. We want some relaxation to be given to the people, but at the same time, we have to control the situation. We have to control the flow of the people. So that is why such restrictions are there. But it may prove to be impractical. And say what is the rate of vaccination in the state now? Vaccination, we have the government says that we are not receiving sufficient quantity of vaccines to fully vaccinate people. But at the same time, we are insisting on at least one dose of vaccine for entry to public places, offices, shops, and banks. That is a problem. We also understand it may create some problem.
Okay, Dr. Anish, could there have been other alternates? I don't know if this is really a practical thing to say, to check everybody's vaccine certificate or test certificate for going into shops and markets.
I also agree to Dr. Sebastian Paul in that aspect, but I want to raise 3 points. One thing is, it is not an experimentation. It is actually a thoughtful strategy that Kerala is having now. I'm not speaking about the vaccination passport or immunity passport or something like that. You look at the strategies, and if you lock down for 2 days in a week, on the 3rd day, there will be a super spreading event can happen because there will be large rush. So just closing the shops, we don't find it is effective. It will not give you some fruits of the lockdown. If you want to lockdown, the lockdown should be for a more significant period of time. So we are finding that there is a lot of super spreading events happening in the shops. That is why we are relaxing that. Second one is the relaxation on the containment to micro containment, as I have already said that it is because of the economic aspects of that. And second point, it is Delta wave. You can actually get the Delta at any point of time if you go out. Suppose you are going to for a large or a significant containment further, then you can be relaxed. Whenever you go out, definitely you will get an infection because it is Delta. So it is the time to get vaccination. Kerala is actually saving a lot of people from infection. And it is actually, we have to vaccinate more number of people and we have to think about vaccinating more rather than keeping them inside the lock or something like that, because it will actually reduce the burden of the problem. That is my point number 2. My point number 3 is if you just the home isolation. You just look at the second wave. When it was peaking in India, Kerala is using the same strategy. The second wave was because of Delta, and we were using the same strategy, and we were actually finishing with the first in the country with 44% zero positivity means the home isolation is working perfectly well in Kerala. And in Kerala, we have enough social system built to support the home isolation and all. You have to look at the data and you will see that home isolation is actually a wonderful strategy that has worked for Kerala. If 90% of people are in home isolation, that means, especially for the patients, that means Kerala is able to pick up even mild cases also. That is why we can keep them at home. So the home isolation and home quarantine is actually a wonderful strategy, worked for Kerala, even at the midst of the second wave, that is because of Delta. So there is no point in just to tell them to change, because that is actually an experimentation. So we are not able to have that kind of an experimentation now.
Okay, valid point that because you've managed to contain it for all this while there is still a larger population which is vulnerable, though like we discussed the last time, I think Dr. Rajiv Dasgupta, you were only there when you pointed out that we'll also need more detailed service to tell us what exactly is the seroprevalence. But here is the other aspect then, which is to say that if the strategy has changed now and we are trying to now bring down the rates basis a micro-containment, is there an example, Dr. Rajiv Dasgupta, that shows that this works? It works better than just following test positivity rate for larger zones and then, clamping down?
Well, there's also a global dimension at present, as most countries in the world are facing the surge on account of the Delta variant. And that's to limit cases as much and as fast as possible so that no new variants emerge. And therefore, that's the larger global worry. This is not about Kerala, but this is about any country or any states within India which is going through this surge phase, including some of the states in the Northeast. So that's really the worry and the urgency, and that's probably where part of the position of the central team is coming from. Now, Kerala, as Dr. Anish said very rightly, Kerala has done many right things in the past, and there is no reason why it wouldn't be able to quickly recalibrate things and re-engineer things. But at this point, the story of Kerala is really the story of these half a dozen odd districts, which is really bearing the brunt of it. Now, there would certainly be some very local or context-specific factors that's driving the surge in these districts, and therefore that's really what needs to be understood. Which again, the central report cannot go into that bit of detail for the simple reason that it's a quick, rapid appraisal of things. But it's really the state experts, the state teams who are best positioned to understand what's really happening at the district, what the local disease dynamics is, and therefore, rather than choosing this model or that model, it's not this versus that, but really what would be most appropriate for these settings and these very specific conditions.
Okay, yes, you're fair enough. Those specific districts and what is on ground maybe unique to them has to be looked at. One more question, because the central team, like you said, also brought it up, is the low vaccination coverage. And Dr. Pramila Devi, if it's a state like Kerala, which has high cases right now, high infection rate, and low vaccine coverage, by default, shouldn't it be getting more vaccines from the center? I mean, that's the center's formula for allocation of vaccines. Give it to states with larger population, larger infection, and lower coverage.
We have already seen that there has been mismanagement of the vaccine supply to the state by the center. Earlier, we have heard such stories that the state is not actually very well managing the distribution of vaccine, and there has been some political manipulation in the vaccination process even. So instead of doing what it can, and instead of making use of the vaccine supplied to the state by the center, the state of Kerala, the government has been criticizing the center unreasonably, illogically, and putting pressure upon the people, saying that the central government is not doing what it has to. In fact, during the pandemic times, all such political malice should be kept at bay, and the state government should be able to do what it has to.
No, but I don't know.
Instead of
So I don't understand what is it that the state government can do if they're not getting the vaccines?
You know, the state government has actually got vaccine. When earlier we have seen it, the state government has been supplied vaccine by the central government, and instead of utilizing it, the state has been criticizing. And also, it's accused that there are so many cases of mismanagement of the vaccination process. It's not usually the well-deserving who get it, and sometimes it's the political party, it's the politicians who interfere with the vaccination process. Those who do not deserve sometimes get it earlier, while the more vulnerable are they don't get it at all.
So Dr. Sebastian Paul, would you like to respond to this? You're giving vaccines to those who are less vulnerable or sitting on vaccine stocks?
No, I think Dr. Pramila Devi is not correct in saying so. There will be complaints, which is only natural, that everyone wants an early vaccination. But according to reports, the central government is fully satisfied with the way the Kerala government is dealing with available vaccines. There is zero wastage, and almost whatever it is available to us, we are making best use of it by launching vaccination programs on a massive scale. Other thing is that local complaints may be there. Some people may say we have not got it. Some complaints will be there. It is local complaints. But as far as the central government is supplying the vaccines. Central government is fully satisfied with the way the Kerala government is managing with the vaccination program with the available vaccines.
Doses per 100 residents, Kerala stands at 55 as opposed to Tripura, which would actually be on top of the table with 78, and Himachal Pradesh 70. And then it's actually Kerala. Above Uttarakhand, Delhi, Gujarat, Jammu and Kashmir, Karnataka, Manipur, Rajasthan, Andhra Pradesh, Telangana, Madhya Pradesh, Chhattisgarh, Maharashtra, national average. Kerala is actually much ahead in that term. So I don't know why that is being quoted as a concern. It's as much as a concern as it would be in any part of the country, Dr. Rajiv Dasgupta, that our vaccine coverage is still far from what we would hope it is. It should be.
No, actually, there are two or three factors. One, Kerala's coverage has so far actually been relatively high.
Yeah.
And as you read out from the list, and again, that's part of the central report, that it's actually quite better compared to the others. The point is, again, this is part of the central report. The point is that the younger age groups have relatively less coverage. They are the most mobile. They are the most economically active. And breakthrough infections with a single dose of vaccine with a Delta-led surge is actually quite high. Now, that's part of the explanation.
Okay.
The other part of the explanation, possibly, and again, this is really a local issue, is, and this is something we discussed one day earlier also, that when vaccination coverage becomes relatively high in some parts and relatively low in other parts, in adjacent areas, that's what is called a patchwork vaccination. Again, this is not a criticism, but it's part of the natural progression. It's really those areas with relatively low vaccination that become more vulnerable, and what's called hyperlocal outbreaks happen there. Now, is it that phenomenon which we are seeing in this half a dozen or so districts? That's something for the local experts to answer, and they would be better equipped to address this.
Okay. So I stand corrected there. You're saying that the lower vaccination is actually in the younger population segment, the one that is going out more, the one that will be reporting to work and is perhaps more exposed to the virus right now than the elderly who would be at home. Point taken. Completely out of time. Thank you so much to all four panelists for joining me on this conversation. Whether or not it works for Kerala remains to be seen. But right now, the government has very clearly taken a decision that they need to balance it out. Yes, the cases are high and they are changing their strategy, moving more towards micro containment than looking at the testing rate for larger zones and then shutting those down, but actually shutting down smaller areas where the cases are high. That's going to be their strategy. All the other areas, they will bring in more relaxation, they will ease the curbs further, bring in relief to people who need to do some business, get to work, especially in times of festival. You would want the economy to pick up a little bit. People who need to get out for the festival for a bit, go shop, all of that. Everybody, though, on the panel agrees that when you come out with rules like you need an RT-PCR test or a vaccine certificate to get into a market or a public place, that's highly impractical and is not going to really work. So such rules, whoever thought of it and wrote it and issued it, really needs to relook at it. Whatever their logic be, it's not really going to work on ground. For everything else, we'll have to wait and watch how the cases in Kerala proceed from here on. For citizens, though, it is also in your hands. Mask up and maintain your distance. Thank you for joining us on this conversation.